My name is Chris Finley, General and Bariatric Surgery with HCA Florida Faucet Surgical Specialist. In general, when we're looking at surgical options for weight loss, there's two main procedures that are now being done nowadays. Both of them are robotic: the Roux-en-Y gastric bypass and the sleeve gastrectomy. And both of them are done robotically, minimally invasive. Both of them involve an overnight stay in the hospital, same diet, same supplements, same kind of post-op care and everything like that. In general, the bypass is a little bit more powerful, on average about 10-15% more weight loss. It has a higher improvement for some of the other comorbidities, the diabetes, sleep apnea, and blood pressure. The sleeve gastrectomy is also a great option. A lot of it has to do with someone's age and comorbidities, and a lot of times the sleeve gastrectomy is a little better tolerated in older patients. The bypass reserved more for younger patients and patients with stronger diabetic impacts. The Roux-en-Y involves making the stomach into a smaller pouch and then attaching a loop of intestines from further down to the pouch, and then reconnecting the main stomach further downstream, so you kind of create this Y shape. That's why it's called a Roux-en-Y, which is just French for shape of Y. And so now your food travels down one separate pipe, and the digestive juices travel down a separate pipe, and absorption now happens about 3 feet downstream. And what that does is it affects how you react to your own insulin and your release of insulin to reverse that insulin resistance. So the first part of your intestines are geared to ramp up your insulin versus further down, they're geared to start turning it off. So when we skip that first part and move absorption further downstream, it has a powerful effect on how you regulate your own insulin and decrease your insulin resistance. The sleeve gastrectomy, you're making the stomach from about the size of a football to about the size of a banana. And the reason why that's effective is that a lot of the cells that live in that part of the stomach that gets removed, they regulate your appetite and your insulin release and a lot of the hormones that regulate your weight. So when that part of the stomach gets removed, there's a big drop in those hormones, and that's what leads to the weight loss. After surgery, we're with our patients every step of the way. We're very involved in our patients' care, and that's very important. It's been scientifically proven to really lead to better outcomes. We follow them very regularly, checking blood work and checking the vitamin and mineral levels, making sure that they're doing okay with their diets, really just making sure that they know that we're there every step of the way.